Hi, it's me, Ingrid INFP, and I'm a medical resident in general practice, and I'm currently at the geriatrics department on a short placement. And these past 2 weeks, I've been at the memory department, and so I'm going to be talking about dementia. I also just got diagnosed with autism about a month ago, so I am interested in all this neurocognitive stuff. And these things do have things in common, dementia and neurodevelopmental disorders. Neurodevelopmental disorders are from birth or from small ages when you're a child and last throughout your life, while dementia comes later in life and progresses. So that's the difference, I guess. But also the whole mechanism of how it happens is different. I'm going to go through the different kinds of dementia, and then I can talk a little bit about my reflections. The first kind is, of course, Alzheimer's, and Alzheimer's is often a memory disorder, but it can also lead to other problems. Often it is this protein that comes and kind of is a bunch of trash that stops the connections between different neurons. It's this protein called tau protein, and it goes and clogs up the system, basically. So these parts don't work as well. And these are mostly working memory, semantic memory, like the things that you say. It could be difficulty with orientation, like knowing where and when it is, like your sense of direction. It can also be, if it's more advanced, like long-term memory can be affected, like knowing who people are, that kind of thing. But it can also lead to strange other symptoms depending on where in the brain these proteins are clogging the system. Mostly it's in the tempoparietal lobes, which is on the side of the brain, but it could also be frontal problems, which is often leads to inhibition, lack of initiative, and mood swings, often if it is up front. And if it's an occipital lobe, then it can, because the occipital lobe is connected to the optic nerve, it can lead to problems with sight and with sight hallucinations. So depending on where and how big the problem is, the more symptoms of different kinds you will have. Then we've got vascular dementia, which is that the blood vessels don't reach all the way to the ends of your brain into the cortex, and it often if you have a stroke, that is a more acute version of this. Basically, a stroke is like there's a stop in one of these blood vessels, and then like a whole part of the brain does not work. Well, you could say that vascular dementia is kind of like all these micro strokes, I guess, like on tiny molecular or cell level. And that means that certain parts of your brain will atrophy because they won't be receiving as much oxygen and nutrients. So it can give all sorts of symptoms, but often this goes together with Alzheimer. But it can be a thing just on its own. Then we've got Parkinson's, which is a problem with the basal ganglia and the dopamine cells in that area that have gotten attacked. And there the problem is the motor neurons that deal with the motor function, and you become very rigid and often have trouble walking because of your rigidity. And that's because the brain is telling all of the muscles and everything to stay taut and not to relax. So that is a problem in Parkinson's, but Parkinson's can also lead to difficulties with balance because of that. So they might fall a lot. They might also get problems with speech and other cognitive functions. Next we have a kind of a weird one, but it's MPH, which is normal pressure hydrocephalus, which means that you have a lot of cerebrovascular fluid in your brain that goes that is in the ventricles of the brain. If you have too much of it, of this liquid, then it will lead to dementia symptoms, often with confusion, it will lead to a kind of dementia, I guess, together with a weird sort of walk because the balance is different, and also to incontinence. And I currently have one such patient in my primary care practice. So it's interesting to see like how the ventricles are larger because there's so much more fluid. So the good thing about that is that there is a treatment which is putting a shunt in that goes from the brain. The fluid gets to be drained out of the body. That is, and often they can become much better because of that. So that's kind of nice to know. And then we've got frontal lobe dementia, Lewy body dementia. So Lewy bodies are also a kind of protein that clogs up the system, I guess. And Lewy body is in the frontal lobe, which deals with executive function. Often these patients have certain days where they're like super active and everything's fine, and certain days that they don't do anything. They can't speak, they can't walk, they're lying in bed. Or it can be different with different people, obviously, but I'm just saying the stereotype. And certain days where they might have hallucinations, and it affects the frontal lobe deals with personality, so it can affect your mood with mood swings and with personality change. So yeah, there's that, and also it can lead to problems with blood pressure, so it makes people more likely to fall. So that's like a great combination, I guess. If you have that, it leads to a lot of problems. I think that this is what Robin Williams had, and that's why he felt so bad. I think that he was really depressed because of that. It is quite tragic. At this memory center that I work at, it's the difficult cases that the primary care centers can't handle. So either it's because it's a very difficult case, or it's because it's a case that is difficult to pinpoint what the disease is. Because sometimes you look at the x-rays, you look at the lumbar puncture sometimes, which is basically taking cerebrospinal fluid and looking if there are proteins in there, for example, the tau protein for Alzheimer's. At my primary care center, we do not do this test. So if you want to do that test to know if somebody has Alzheimer's, you need to send them to the memory center. I call it the memory center because it's called minnesmottagning in Swedish. There's probably a better name for it. And they have really long visits, 1.5 hours often. It's there's a testing part, which is something that I can do as a primary care doctor as well. I do testing, and then a lot of talking about what this person has problems with, how their life looks like, because cognition affects everything. It affects your relations with people, it affects what you can do, it affects where you can live, it affects a lot of things. And so it's very long discussions with the patients and with somebody that they know. So, a spouse or a child of, and their parents is there, so I found that it is very nice to be there because the tempo is very slow. Apparently the doctor that I've been following actually has had a stroke, and he couldn't deal with the pressures of working at a ward. He kept getting migraines because of that. And now that he's at this memory center, he is much more happy, I think, because the tempo is slow enough, and he can become an expert on this specific field. So he really loves talking about this, and it has been really positive for me. Also because I've got to finish early, which is always a plus. So it's just interesting because I know that I would have a hard time with certain of these dementia tests, and that's because of my shitty working memory and because of the fact that I'm quite slow. So I would probably do, average on these tests, but I think I would do less good than somebody else my age on certain things. On certain things, I think I would do pretty well, because as they are testing the patients, I'm trying to test myself to see if, could I manage this? Yes, I could manage it, but I think that's it's maybe not as good as some people. And I have done certain of these kinds of tests when I was getting my autism diagnosis. So it's pretty interesting. There's a lot of discussion of executive function, like managing to do certain steps in a certain order, managing to remember to do things, which I definitely have problems with. And the person that we met today, actually, she is a very active person, but her son has ADHD, and she probably has an undiagnosed ADHD herself. And how that affects dementia is quite interesting, because she wants to do all these things and she wants to do them fast, but she is not quite capable of doing them as fast because her memory is so bad. So it leads to her making mistakes. And that's kind of a thing that people with ADHD, without dementia, have problems with, is making silly mistakes because they're trying to rush through it too fast without enough attention and concentration to go with it. So I could see that when she was doing the tests, she was trying to do it really fast, but she would make mistakes on the way, and that affects how she did on the testing, So what is the situation that she had before she got dementia and after? So now she has Alzheimer's, which is getting worse progressively, but slowly. She does a lot of things that are that makes her happy, and if you sit with this person for a longer period, like an hour and a half, like I did, then you will realize that this person has problems with their memory. But if you just meet this person on the street, you would have no idea, That's kind of how it is with some people with dementia. But some people with dementia, it's really clear that this is not working, and they need support 24/7. There's a huge variation. And so I don't want to compare autism and ADHD with dementia, but there are some similarities because they both have to do with the brain. It's just a different process. Since one of them is neurodegenerative and another one is a different development of the brain. There is, I don't have any sources, but I know that there are studies that have shown that people with ADHD or autism have an increased risk of developing dementia when they get older. I don't know why. I don't know if anybody knows why. I haven't done the research on that, so I must admit. But it's interesting to think of how these things can go together. Maybe one day we'll know the process of how these things develop. There are certain things that are good to decrease your risk of dementia, of getting dementia or getting worse in dementia, and that is eating right, it's exercising, it's having social contact, it's taking your medication if you have any that has to do with your blood vessels, and it's also keeping your brain active through, for example, just making like writing crosswords or that kind of thing, or even just or reading a book or doing something that uses your brain function. So I think that's pretty much it. I am having a fun time learning about all of this. I still have one day left at the memory center before I leave for the mobile team function that the geriatrics have. The mobile team is quite fun because you get to go home to these 90-year-old ladies and basically have a little chat and just check up on these people. It's pretty fun, and mostly these are people who are very healthy, because otherwise they would be in the hospital or in a home. These are people who can stay at home until they die at the ripe old age of 95 or something. And they're just, it's just fun also to be on the go and see a little bit how people live and what we can do for them. So I'm going to be doing that next week. But yeah, so have a great day, everybody. Bye.